Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. We're going to be discussing anterior pituitary gland pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to the updated material. Now let's start off with a pituitary adenoma. A pituitary adenoma is a benign tumor of anterior pituitary cells. Pituitary adenomas may be functional, meaning it is actually hormone-producing. And they may also be non-functional, meaning they can be clinically silent. Non-functional tumors often present with mass effect, right? You might get some CNS symptoms, such as bitemporal hemianopia or hemianopsia, depending on how you pronounce it or spell it. This may occur due to compression of the optic chiasm. Compressed normal pituitary tissue causes hypopituitarism. Based on the type of hormone produced, functional tumors have certain characteristics, such as a prolactinoma, right? A prolactinoma presents as galactorrhea and amenorrhea in females, or as a decreased libido and headache in males. Among the majority of pituitary tumors, about 30% of them are prolactin secreting pituitary adenomas, right? That's pretty common, which is why you should know about it. Pituitary adenomas are considered the most common type. The treatment used for this condition are dopamine agonists such as bromocriptine or cabergoline, right? You remember those from pharm. And those are utilized to suppress prolactin production, which will shrink the tumor. And surgery is another option, especially when the lesions are bigger, larger, grande, right? So future neurosurgeons, look out for this. And since we're talking about tumors and enlarged growths in the brain, we must talk about a growth hormone cell adenoma. Growth hormone cell adenoma causes gigantism in children, characterized by increased linear bone growth. That epiphyses aren't fused, right? Which is why. They have high levels of growth hormones in the body, which cause them to become unusually tall. Growth hormone cell adenoma causes acromegaly in adults, characterized with enlarged bones, especially of the hands, feet, and jaw. This happens when the body produces excessive growth hormone in adults. The growth of visceral organs may cause the progression of organ dysfunction and cardiac failure. Secondary diabetes mellitus is often present and induces liver gluconeogenesis. Growth hormone induces liver gluconeogenesis. Growth hormone cell adenoma is diagnosed by an elevated growth hormone and insulin growth factor 1 levels, along with a lack of growth hormone suppression by an oral glucose. Now, how do we treat growth hormone cell adenoma? Well, we can use octreotide, a somatostatin analog that suppresses growth hormone release. This is the drug of choice for treatment of growth hormone cell adenoma. Growth hormone receptor antagonists and surgery may also be necessary. Now let's talk about Adrenocorticotropic hormone releasing tumors. Adrenocorticotropic releasing tumors. ACTH? Yes, you've heard of that. ACTH releasing tumors are a type of adenoma that secrete ACTH, leading to what? Leading to Cushing syndrome, right? Classically. Adrenocorticotropic hormone releasing tumors, right, is associated with Cushing syndrome. And Cushing syndrome is a condition that develops when the body consistently produces excessive amounts of the hormone cortisol. Now, you know about cortisol, right? That's the what hormone? The stress hormone. The stress hormone. Cortisol, right? When you have to wake up early and your alarm's going off. Yeah, cortisol flowing through your bones. Thyroid stimulating hormone cells, luteinizing hormone producing, and follicle stimulating hormone producing adenomas occur, but those are rare. And here we have a silent gonadotroph pituitary adenoma, which is, in this case, very eosinophilic, contrary to the normal basophilic gonadotroph cells. And here we have a somatotroph pituitary adenoma showing acidophilic cytoplasm. And here we have various stains that you will not be asked about unless you are a surgical pathologist doing your fellowship. Now let's talk about hypopituitarism. Hypopituitarism is a condition wherein the anterior pituitary gland is not producing enough hormones. I repeat, hypopituitarism, hypopituitarism is a condition wherein the anterior pituitary gland is not producing enough hormones. Symptoms of hypopituitarism arise when more than 75% of the pituitary parenchyma is lost. Causes of hypopituitarism include pituitary adenomas in adults or craniopharyngiomas in children. And this is caused by the mass effect or pituitary apoplexy, which is the bleeding into an adenoma. And Sheehan syndrome, which you definitely will be asked about. Sheehan syndrome, commonly known as the postpartum pituitary necrosis. And this condition describes an infarction of anterior pituitary gland cells. Although the size of the gland increases during pregnancy, the blood supply does not greatly increase. Parturition-related blood loss causes an infarction to occur, right? If there's no blood support, lack of oxygen, infarction. Symptoms of hypopituitarism include poor lactation, pubic hair loss, and fatigue. Empty Sella Syndrome is a rare disorder when the pituitary gland flattens or decreases as a result of problems with the sella turcica's contents. Herniation of the arachnoid and cerebral spinal fluid, otherwise known as CSF, into the sella turcica compresses and destroys the pituitary gland. The pituitary gland is absent, which indicates the sella turcica is empty on imaging. And with that, you've completed yet another presentation. Give yourself a pat on the back. I hope you're smiling. I hope you're happy. I hope you realize that you are a genius. You're so smart and consistent. You're going to do it. You're going to rock everything. Anything you put your mind to, you can achieve, for sure. Keep up the good work, and I'll see you later.